about this? Your healthcare experience in the future will be entirely different from today's reactive sick care system. Would you let a physical therapy robot teach you to walk? Would you like your smartphone to be your psychological counselor? Would you go under the knife of a robotic surgeon? Robotically assisted surgery is changing the OR by allowing surgeons a very high level of accuracy through intuitive motion control, high-resolution 3D imagery, and advanced risk design. Robotics improves the surgeon's skills in a number of ways, including filtering out hand tremors. Surgeries become much more precise and minimally invasive. This is the Da Vinci system from Intuitive Surgical. It's been in use for 15 years, and its list of robotic-assisted surgical procedures keeps growing.
One of the goals of the Da Vinci surgical platform is to give surgeons excellent precision with their instruments. So we have what's called motion scaling, which actually takes the motion of the surgeon's hands and it scales it down. For example, if a surgeon moves their instruments, or their hands rather, 3 centimeters on the outside with the controllers, it'll translate down to 1 centimeter inside the patient, so it lets them do really fine, precise movements. But I don't think it's hard to imagine into the future where you have artificial intelligence perhaps that is being used in conjunction with robotic surgery, and it may be some time before we get to a fully automated robotic procedure, but you can certainly think about automating specific surgical tasks, maybe repetitive tasks like suturing or dissecting.
But what about when the surgeon is taken out of the equation, either in part or in full, and replaced by artificial intelligence? A Duke University study demonstrated that AI could identify and biopsy simulated breast and prostate cancer lesions with a high degree of accuracy. In a recent test, an AI-controlled robot was able to outperform a human when stitching together soft tissue. Google and Johnson & Johnson are developing artificial intelligence that uses advanced imaging and sensors to augment a surgeon's skills in the OR.
Bringing robotics and artificial intelligence into the operating room is a really exciting chance to smooth over health disparities. What if it didn't cost so much money to access the best human surgeon to get the best surgery?
So if everybody had access to a robotic and AI-enabled surgeon, then those disparities based on wealth and who can afford the best surgeon would start to go away.
Robotics are also providing healing outside of the operating room, like in physical therapy. This exoskeleton technology developed by Exobionics is helping stroke patients and patients with spinal cord injuries stand and walk sooner than usual, getting them on the road to recovery faster and more completely. It's designed for use in rehabilitation clinics, where it customizes the level of assistance to each individual's unique needs. It's the first technology of its kind to gain FDA approval for these uses. Clearly, these developments are a boon for patient care. But what do technologies like these mean for doctors, nurses, physical therapists, and other medical professionals?
Our paradigm of how we think about medicine is changing. Right now, the paradigm is when you feel sick, you go to the hospital and you meet a doctor who has his stethoscope in his hand. We envision that that's not the way medicine is going to be in the very near future. It used to be that doctor knows best, that the doctor was a father figure who made decisions for us. Now, with the growing availability of our data, our own data, we are empowering people to become the CEOs of their own health. You're the one who's controlling the data and the information, and you're the one who's making the decisions with consultation from medical professionals. Doctors and nurses and therapists and psychologists are going to have to be thinking, what does my job look like in the future? What does it mean to be a doctor when the robot is doing the surgeon? Then what's the surgeon, the human surgeon's job?
The same may be true for mental health services. Artificial intelligence is creating inroads into this field where human understanding and compassion have long been considered essential. Meet Ellie.
Thanks for coming in today. I was created to talk to people in a safe and secure environment.
Ellie is part of a USC virtual reality program called SimSensei. It's a DARPA-funded effort to find ways to treat people with depression and post-traumatic stress disorder. The software looks at 66 points on a human face and can recognize many of the subtle conversational and body language cues that we all use. This allows Ellie to adjust her behavior, questions, and responses accordingly.
Is it uncomfortable for you to talk about this?
What's more interesting is that many test subjects are more honest and forthcoming with Ellie than when talking to a human therapist. Apparently, they feel less judged by a virtual person. Another approach is TESS, the artificial intelligence software from X2 AI. TESS provides a variety of psychological services by using SMS text messaging to hold mental health conversations. TESS speaks 5 languages. An Arabic language version of TESS is providing mental health assistance to Syrian refugees displaced in Lebanon.
Virtual therapy with an AI therapist is an exciting advance, which means, for example, soldiers with PTSD who might be hesitant to talk about the emotions that they're experiencing may find it easier to speak to a non-human therapist than to a human therapist.
Exponential technology developments will help improve doctors' skills, maximize their available time, help serve many more patients, and ultimately make healthcare more affordable and available throughout the world.